Hey everyone, thanks for joining our Facebook Live. Today is Monday, February 27th. I hope everyone's having a lovely day. It is raining here in Sacramento, so just trying to stay inside and keep warm. Today we wanted to go live on Facebook and talk a little bit about COVID-19. For one of our grants, the Youth Engagement Partnership Program that we've been doing with the youth, we've been doing a lot of COVID work. And in our first round of the project, we ended up working with a youth task force and then designing some billboards around COVID-19. And in this cycle, we're hosting a photo voice campaign, as well as trying to do some Facebook Lives on COVID-19 information for the community. Recently, we launched a frequently asked questions page on what was it, a Google form, and then on all our social platforms using poll features. And we got a ton of questions from community members, so we wanted to take the time to answer them. We have been working with different Native public health workers to answer these questions, as well as with the state. And we have a few questions that we would want to go through today. And I want to let my colleague introduce herself here that I'm with. So go ahead and take it over.
Hi, everyone. My name is Teyah Lopez. I'm a project manager at the California Consortium for Urban Indian Health. And yeah, I oversee a bunch of projects with Wyatt, my colleague, and some other colleagues working on COVID, HIV, HCV, mental health and well-being, bunch of stuff. So excited to be here with you all today.
Thanks, Taya. So yeah, we just want to jump right into it and go over a few of our questions. I'll be answering the first few, and we'll just kind of, Taya and I will go back and forth reading and answering the questions we've got from our polls, as well as the answers we've created in conversation with public health officials and a lot of community members. So one of the main questions we've got asked was how the COVID-19 vaccines were authorized. And, it's been 3 years now. It's 2023. So we've been dealing with COVID for 3 years now. So we have a good amount of data to kind of talk a little bit in depth around how they were authorized. So they were authorized after data reviews showed that there was clear evidence that they're safe, effective, and the benefits completely outweigh the risk of vaccination. So it's really good to get a vaccine because the benefits, especially now with the cold seasons going around and so many different variants, the vaccines are the most effective way to stay safe and not catch a really bad case of COVID. And the vaccines are continuously undergoing the most intense safety monitoring in U.S. history compared to any other vaccine. So we're seeing a lot of public health officials in the states and local governments really making sure that these vaccines are effective for our youth, for our elders, for everyone in our community. And thanks to VSafe, VARS, and VSD, we know that the vaccine is an incredibly safe way to protect adults and children against COVID-19, especially with the new variants. So overall, all the data that we've been taking over or getting back from the state in the past 3 years has really shown that they're the most effective way and most effective thing we have right now to fight against COVID-19. Another question that we got was, is there any treatments available from if I get sick from COVID-19 infection? So the FDA has authorized several COVID-19 therapeutics after scientific evidence showed that they were effective in reducing the risk of serious illness from COVID-19. So the best answer that we got from the state and from everyone we've talked to around these COVID questions was reaching out to your current healthcare provider, whether that be Indian Health Services or whoever's near you on the reservation, or even if it's Kaiser or Blue, whatever you have for insurance, just checking in with your healthcare provider to learn more about the different medications that would best be fit for your case of COVID-19. Because some people get COVID-19, it can be a lot more severe than others, and they're dealing with different symptoms as well. So it's really important to go ahead and contact your healthcare provider to get their take on what is going to be the best help for you personally and your case of COVID. Someone had brought up this, I have actually never heard about this. It's levermectin, and someone brought this up, but the FDA has not authorized that in the use of preventing COVID-19, and it hasn't been shown to be safe with humans. So that's something that if you hear about that a lot, it's something you should definitely avoid because it hasn't been being tested. And the FDA is currently saying that it's not safe for humans. So if you do hear about that, I just wanted to bring it up because that was a comment that we got back regarding these questions.
Yes. Also, it's pronounced ivermectin. So if you hear
Ivermectin.
ivermectin, yeah.
Thank you, Taya.
Yes.
Do you want to take over with some of the upcoming questions?
Yes. So these are some of the questions that we got from our polls on our social medias. So one of the questions that community had were, what are the what are the chances of catching COVID now, especially with optional masking and lots of folks not wearing masks? So this really depends on you. If you've been vaccinated, if you have previously had COVID, also depends on how often you're out in crowded spaces with other folks who may or may not be masked, may or may not be vaccinated. Also depends on the date of your last COVID infection or last COVID vaccine. As we know, like the closer it is to your latest vaccine or infection, the less likely you are to get it. But the farther out from it, the more likely you are to get it. Another thing to consider with likeliness of getting it is that, originally was the alpha variant of COVID, and that had a certain degree of being transmissible from one person to another. But as the variants continued to progress and get better at hiding from our immune system, the new variants now, like Omicron and its further variants, are a little bit easier to be transmitted from one person to the next, just because they're a little bit better at hiding from our immune system. So it depends on a lot of things, but overall, if you're taking the precautions to protect yourself that make sense for you, then your chances of getting it remain low if you take all the precautions that are safe for you, like masking, getting vaccinated, staying home, whatever makes sense for you. One other question that we got from these polls are, why are people not taking precautions anymore? And again, this question has a answer with a lot of different nuances and variations depending on who you ask and where you are in the state, things like that. But some really big generalizations I can give for why people aren't masking or taking as many precautions as they were, say, in 2020 or 2021 is COVID fatigue. We hear that a lot, or pandemic fatigue. People are just tired of being inside, hearing about COVID, hearing about all the bad, nasty things that happen because of it. And they just want to be outside, back to normal again. And that's not to say that the virus is over or it poses less of a threat, but it is, something that we have to deal with. People want to get back outside and live life normally again. Another thing to take into account is that, because people do want to return to normal, there is this pressure for, if you're outside and you're with a group of 10 people not wearing a mask, there might be some pressure for you to also not wear a mask. There's a societal pressure. You don't want to be the odd person out, the odd person in the grocery store wearing a mask. So that's another thing. And then also just seeing less messaging around it as well. I think at first we were seeing, every week there's a new variant out, or every few months there's a new variant out. And now, I don't know, I personally couldn't, and I don't know if you could, Wyatt, like name the latest variant or the one that's like most common, So I feel like it's just very much also just like a slowdown of messaging from, maybe the government or like agencies that could be putting out information about COVID.
Yeah, I wanted to jump in real quick too, and also just on this question as well that we got, another thing to take into account around why people aren't taking as many precautions anymore when you're out and about, because this is a question we got a few times from community members. And I think one of the real big reasons is a lot of people nowadays are vaccinated and they have got their booster shot. So a lot of people are starting to feel a lot more comfortable being in the world as how it was pre-pandemic, because they're they have the vaccine and they have the booster, and those are effective ways to not catch COVID. So I think a lot of people who have their vaccines and boosters are really trying to like ease off of wearing a mask all the time, because they feel a lot safer being in a public space without taking as many precautions anymore.
Yeah, that also reminds me too, is at this point in the pandemic, I feel like a lot of people have gotten COVID at least once. And so, at the beginning, it was very scary because we were just like, oh, no one knows what COVID is. No one knows the effects that it can have on you long term. And although we still don't really know the long term effects, like I think having gotten COVID one time before makes it less scary to get it again. Whereas never having it makes it really scary to get it for the first time. So that could also be a contributing factor.
Mm-hmm.
All right. The next question that we wanted to talk about was about boosters. Someone mentioned that they got their first round of COVID shots in 2020, the one where you had to get the first boost or the first vaccine and then wait 2 weeks to get the next one. And they just wanted to know if they got the first round of vaccines, should they get their booster shot this year and if it's necessary. And what CCUIH would say about this is that boosters and staying up to date on your vaccines are always recommended. Vaccines, and specifically the COVID vaccine, are giving your body the most up-to-date instructions that we have on how to identify the COVID vaccine when it comes into your body and how to get rid of it once it starts, making you sick. And so by getting the booster, you're giving your body like the latest instructions and the latest information about how to identify COVID in your body and how to get rid of it. And so we definitely recommend getting the booster. The most recent booster, the bivalent booster, is actually more targeted to Omicron and its further variants. So it will help better protect against, the current variants of COVID going around. Whereas if you only have the first series of vaccines back in 2020 or 2021, those are more geared towards the original alpha variant of COVID. And although it will still protect you, it's just better to keep refreshing your body's instructions for how to deal with COVID once it's in your body.
Yeah, we got another question regarding boosters as well. Actually, a few questions relating to boosters. But the next one that came in was, someone asked, does getting boosters really change the chance of me getting COVID? It seems like there is a new booster every few months. And I feel that because, you see it on the news and they always have these new names for different boosters and what's coming out and what's latest. So we really wanted to kind of give some clarity around the booster shot. So recent data has been showing that adults who receive the updated bivalent boosters, like Teyah was just mentioning, reduce their risk of infection by at least 40% compared to those who have not received their primary series. So if you got the initial booster, and then you have the new booster, which is the bivalent one, then you have a 40% less chance of getting a severe infection of COVID-19. And then also after looking at 2 years of data, it shows that the mRNA COVID vaccines are incredibly effective to protect against serious illness, especially when comparing it to the alpha original variant of COVID that we've had. So the first booster doses were monovalent, and then they were targeting the original strain of COVID, while the new ones are bivalent and target both the original strain and the Omicron strains, causing the most recent cases of COVID. Let's see. An updated bivalent booster dose provides significant additional protection against COVID-19 symptoms compared to monovalent vaccines alone. So if you can get the bivalent booster, it's going to be your best protection method, especially with all the variants that are going out now, because those have all come off of the Omicron variant and the new strains are coming off of that Omicron variant. So you're going to be a lot more protected to get that bivalent booster rather than just keeping a monovalent booster. But like Teyah mentioned, there's a lot of, factors that go into COVID-19 infections and how severe sickness you get. It really just depends on the individual, because some people, they don't even get the bivalent booster and then they get COVID again and it doesn't affect them that much, and others get it and it, puts them in the hospital. So it is really important to, take every measure you can for yourself that you feel safe with, to protect your body from COVID-19, especially now moving into these cold, rainy days and winter months.
Yeah, definitely, Wyatt. Thank you for bringing that up. I think, winter is a really hard time for just illnesses in general. And that kind of leads me into the next question that we got from community. They were asking about, with all of these sicknesses that are going around, especially in this winter that we're in right now, we heard about COVID for the past few years, but also the flu season came a lot earlier than we expected. There was RSV going around, monkeypox, so many different sicknesses that we weren't previously aware of. And so one of the questions that we got on our polls was, do boosters help protect from other illnesses such as flu, cold, monkeypox, RSV, things like that? And unfortunately, the COVID booster and the COVID vaccines do not protect against these things. Only just the COVID boosters and the vaccines only protect against COVID-19. So for the flu, for the cold, for RSV, for monkeypox, they all have their own precautions that you can take to protect yourself for them, especially like the flu and RSV. that are caused by viruses. You can get vaccines for those, but each specifically has their own vaccine and preventative measures to take. Unfortunately, the COVID vaccine and boosters only protect against COVID. So, yeah.
Yeah, it's really rough. And I really just hope that, everyone is staying up to date on their boosters and taking all the precautions that they can to remain safe, because it's been tough. It's been a tough 3 years for a lot of people and a lot of families. And I know I've had, really bad cases of COVID in my family that have really affected me, and even lost some people to COVID-19. So I really do hope that everyone is, staying safe and taking precautions. And that's, another reason why I wanted to do this live, is to make sure that, we're staying up to date and keeping the community updated with what's going on and answering the questions that they have. So there is an answer for them. Another question we have was also related to the boosters, and it is, how effective are the new boosters compared to the previous? Why do I need it? So the original doses of COVID vaccines in the first round of boosters were targeted towards the first iteration of COVID virus that we saw in 2020. And as the virus adapts and changes, the original vaccine that we had got in 2020, in the first booster we got, it loses efficacy, because over time, all these new strains are coming out, Omicron, and then there's new strains off of Omicron. So then that original vaccine and booster doesn't really have the proper instructions, like Teyah mentioned. It's like updating the software to be like, this is what's new and this is how you're going to deal with it. Your body doesn't have that if you don't have the updated boosters or the updated vaccines, because it's based off of that original strain that we saw 3 years ago now. So it's really important that you keep your body up to date and have those new instructions on how to deal with COVID nowadays when it comes around. So the new bivalent booster is the most up-to-date vaccine to help protect against current variants, such as the Omicron variants. And that's the bivalent one that has those variants connected to it. So that's the most updated one. And the one that you should be getting now, if you are to get a booster, would be the bivalent. Like, I'm honestly not sure if they even give out the monovalent booster anymore. I'm pretty sure that if you get a booster now, it's going to be the bivalent one. So if you haven't got a booster, that's your best bet at staying safe through these winter months and through different COVID variants that are coming out of the Omicron one. So please do take every precaution you can to stay safe.
Yes. And if y'all have any more questions about COVID, infection, treatment, prevention, transmission, things like that, please feel free to ask us and we can help you out.
Yes, and on the comment section of this video, I'll go ahead and throw in the FAQ where you can submit questions. And for our next round of Facebook Live, when we go live again, answering more questions that we get, we'll be sure to answer your question in that video as well. We're also working to develop a COVID page on our CCUIH website at CCUIH.org. We're going to be having a page specifically for our Facebook Lives and our FAQ section. So you'll be able to submit your questions on CCUIH.org here in the next few weeks. So please do stay up to date with that. And please do keep yourself safe and get your booster if you haven't got it yet, because it's the most effective way and 40% chance of getting a less severe COVID infection.
Yeah. Thanks, everyone. Stay safe, stay warm.
Thank you all. We'll see you next time. Bye.